In any clinical or healthcare setting, precision in communication is not just a best practice, it is a fundamental component of patient safety. The accurate use and interpretation of medical abbreviations, symbols, and terminology can directly impact patient care, medication administration, and diagnostic accuracy. A simple misunderstanding can lead to significant errors. This educational module is designed to provide a comprehensive review of common medical abbreviations and best practices. We will focus on preventing errors and ensuring clear, unambiguous communication among all members of the healthcare team. Our primary objective is to reinforce the knowledge required to interpret and document clinical information safely and effectively. Accurate interpretation of medication orders is critical for patient health. Common abbreviations include NPO or nil per os, which is a directive meaning nothing by mouth, typically used in preparation for a procedure. We also frequently see PRN or pro re nata, which instructs that medication be administered only as needed based on symptoms. Other essential terms include SL or sublingual, referring to a route where medication is placed under the tongue for rapid absorption into the bloodstream. It is also vital to recognize chemical abbreviations like ASA for acetylsalicylic acid, commonly known as aspirin, and APAP, which stands for the pain reliever Acetaminophen. To mitigate risks, certain abbreviations are discouraged by the Joint Commission. For dosing frequency, you must write out the word daily instead of using QD, which is easily confused with QID, meaning 4 times daily. Similarly, always write every other day instead of QOD to prevent dangerous misunderstandings in medication timing. Numerical notation is another area where precision saves lives. A leading zero is strictly required before a decimal point, such as writing 0.5 milligrams. Without that leading zero, the decimal point might be overlooked, causing a clinician to misread the dose as a whole 5 milligrams, leading to a tenfold error. Conversely, a trailing zero should never be used for whole numbers. You should document 5 milligrams as a single digit, never as 5.0. If the decimal point is missed or faint on a printed or handwritten chart, 5.0 can easily be mistaken for 50 milligrams, resulting in a massive overdose. Ambiguous abbreviations must be eliminated. The term IU for international unit is avoided because it can be mistaken for IV or the number 10. Similarly, CC for cubic centimeter is discouraged because it can look like the letter U for units. The correct and safest term to use is always ml for milliliters. Drug name abbreviations also pose significant risks. MSO4 is no longer used for morphine sulfate because it is too easily confused with magnesium sulfate, which stands for magnesium sulfate. Because these two medications have vastly different effects, confusing them can be fatal. Always write out the full name of the medication to ensure clarity. Familiarity with diagnostic abbreviations is essential for understanding a patient's medical history. Key cardiac terms include CAD for coronary artery disease, CHF for congestive heart failure, and MI for myocardial infarction or heart attack. Additionally, CVA refers to a cerebrovascular accident, which is the clinical term for a stroke. In general charting, you will often encounter versus WNL, which indicates that the patient's vital signs are within normal limits. Another critical notation is NKDA, which signifies that the patient has no known drug allergies. Recognizing these quickly is vital for safe intake and ongoing assessment during a patient's stay. Physical therapy and rehabilitation documentation utilize their own set of standard abbreviations. Range of motion is often described as PROM, meaning passive range of motion, where the therapist moves the joint, or AAROM for active assistive range of motion, where the patient performs the movement with some help or guidance. Weight-bearing status is another critical area in therapy. NWB stands for non-weight-bearing, meaning no weight should be placed on the limb. FWB means full weight bearing, while WBAT stands for weight bearing as tolerated, allowing the patient to put as much weight on the limb as their comfort level permits. Functional terms are also common in rehab notes. AD refers to activities of daily living, such as dressing or hygiene, which are used to measure independence. Finally, a HEP is a home exercise program, a specific set of movements designed for the patient to continue their recovery outside of the clinical setting. In conclusion, standardized and unambiguous medical terminology is the backbone of safe practice. The core principle is that clarity must always take precedence over brevity. Adhering to these best practices is a professional responsibility that ensures we collaborate effectively as a team and, most importantly, deliver the safest possible care to every patient.